So Loma Linda itself, the blue zone, as you were saying, so that probably most popularized by the book by Dan Buettner. I think he looks at 6 different blue zones in the world. Blue zones being the places in the world that have the most centenarians, or people living to over 100. And probably the most important part is they're not just living to 100, they're living in good health until 100. You know, modern medicine is pretty good at keeping people alive, but the difference is they are thriving until they are in their hundreds. And they kind of identified key features of why. On the lines of nutrition, a lot of the ones in Loma Linda are a plant-based diet, lots of whole grains, lots of soy foods, lots of fruits and vegetables, you know, minimal meat. Even in the 50% that I was talking about that do consume animal products, the average amount is only 4% of the diet, with about 10% from dairy. So dramatically less than the sort of the standard American diet, which I think is about 60% meat and dairy foods, and then maybe 40% processed foods and not much else. Your average plant-based eater has a body mass index of 24, which is within the healthy weight range. They're actually the only group that fell within the healthy weight range. Vegetarians are just slightly overweight, 25, 26, and it goes again stepwise from there.
Which is an increased risk for a number of chronic diseases.
Basically everything.
Yeah.
You know, it can be difficult because there's a lot of movement towards body acceptance, fat shaming, and I'm very mindful of that in my practice. I would, especially, you know, not being sexist, but especially with women, there is a huge stigma of being overweight. And it's not about judgmental or, you know, even anything to do with appearance, but being obese in itself, carrying excess body fat, is a pro-inflammatory state. Basically, high levels of inflammation cause almost every disease that we know of. So it's got nothing to do with what you look like or whether you can look hot in a bikini. This is literally the same as smoking or the same as drinking to excess.
There's so much, there's a much more deeper meaning behind losing weight than just the vanity aspect.
It has nothing to do with that from a medical perspective. It has to do with preventing disease. Knowing that, you know, like we say, 80-90% of all disease is related to lifestyle. That's huge. That means, like, if you think of your whole lifespan, 90% of the times you're going to get sick are going to be eliminated. You're only going to have, say, 10% or less. Like, that's so inspiring and empowering to patients. I think that's like a huge motivation for me to be like, I have so much control over my own health and future, over what a pleasurable bite of food or, you know, ease, convenience. Like, no, I'm going to put in the effort. I'm going to get up and, you know, do some physical activity. I'm going to make healthier choices when I go shopping, because that to me represents what I'm seeing in the Loma Linda patients of being 90 and, you know, in good health. It is not uncommon to have a patient come to my clinic, they're 92, their chief complaint or reason for their visit to the clinic is they're there for their annual physical. Their medical history is that they gave birth in Loma Linda Hospital 60 years ago. That's the only time they've ever been hospitalized. They're on no medications, and their favorite thing to do is hang out with their great grandchildren and go to the gym. Like,
so getting old and associating that with disease and cancer is not the way they think.
You know, we see people on the flip side in the hospital that are 54 and, you know, terminal. I'm referring them to palliative care. It's just such a stark comparison.
I think a lot of people in, you know, proper, I guess, Western populations with a Western population mentality just assume that it's part of getting old. Having a heart attack, having a stroke, or having a cancer, it's inevitable. One of those is gonna kill me at some stage.
Exactly. I remember meeting, actually, the girl I mentioned that was at True North for her 21st birthday. She said to me, she was like, you know, until I found out about this lifestyle, I just kind of thought, you know, I wonder what disease I will get. And I think that's really common for a lot of people. You know, you just kind of think as you get older, like, oh, I wonder what I'm going to die from. Will it be heart disease? Will it be cancer? You know, everyone in my family has cancer. I know that I'll probably get it one day. And it's like, I think that, you know, you spoke to Neil Barnard yesterday, and I'm sure he probably said his favorite line of, you know, genetics load the gun, lifestyle environment pulls the trigger. And I really do believe that. Like, I know in my family, we have so much cancer. I know that my gun is loaded with cancer, but I'm going to do everything that I can to not pull that trigger. And I think that that is super empowering for people to really understand the limited role that genetics has in most diseases. Like you said earlier, there are people, unfortunately, we do have some genetics. I was listening to your talk with Dr. Robert Oswald talking about Tay-Sachs. Super, super, super sad. We still have some genetic levels. But knowing that so much of it is lifestyle is really, really, really exciting, I think. I can see that when they adopt it, they get the exact same benefits as anyone else. So it takes away that idea that plant-based diet or veganism is expensive, that you have to buy, superfoods, like going and buying, I don't know, $25 chlorella or whatever it is. You don't have to do that. You can literally go to the dollar store, buy the cheapest frozen fruits and vegetables there is, the cheapest bulk rice, the cheapest dried beans, and get rid of your diabetes. Lose the excess body weight, get rid of your diabetes, recover from strokes, get rid of endometriosis,
prevent future cancers.
There's just so much benefit, and I'm seeing that day in, day out for those that are open to doing something a little different. This recent surge in ketogenic diets, high meat, low carbohydrate diets has just been frightening from a medical perspective. I am not going to say it doesn't work for weight loss. It does. It's a condition of disease, really. Being in ketosis is what we see when people are extremely ill. There's nothing healthy about it. A diabetic in ketoacidosis is going to come into the hospital, but usually the ICU. Like, that's having to go into intensive care because you're in ketosis. How this even possibly became a thing for health, I have zero idea. But the real obvious striking comparisons that we see is cholesterol. On people that I have seen following these high animal product diets, their cholesterol is through the roof. I work in a different metric system in the US, so I'm talking 350, 400 cholesterol, which I think is like 8, 9, 10 in Australian numbers. We want it less than 5, preferably less. Cuddle Esselstyn, T. Colin Campbell, they talk about your heart attack proof number of being less than 150 for total cholesterol. I'm seeing people with double that. Like, that's frightening, and it's coming directly from the overconsumption of animal foods. And I have had the pleasure of working with people and politely saying what you're doing is going to give you heart disease. You might be skinny, but you're still going to die. And getting them to think about a plant-based diet and just watching the cholesterol fall off. Far more aggressive than I've seen with medical treatment, and way faster than I'd expect. You often hear doctors joking about it, and people telling, especially patients telling their stories, that their doctor think it's a lab error. That's how fast you can drop your cholesterol. I've had people in 6 weeks halve their cholesterol, maybe drop 50 to 100 points in just a matter of 6 weeks by cutting out the meat and the dairy, and blood pressure goes down dramatically. The weight loss is usually more dramatic after that. So what gets people really excited about a low carbohydrate diet is we hold about 8 pounds or 4 kilograms of glycogen. So once you lose that, and then every gram of glycogen can hold up to 4 grams of water. That's a ton of weight loss initially.
But it's not true weight loss.
No,
it's
of course not.
Your store of your glucose.
Of course not. And so if you want to do any type of athletic pursuit, you have zero energy or motivation or any way to even really incorporate your muscles. So that's going to take away a huge part. Physical activity is essential to maintaining a healthy body weight within reason. And then we're talking about losing all this water weight. So the initial part of it is super motivating, and that doesn't happen with a plant-based diet. But what you see is a very rapid stagnation or plateau of weight loss on these other diets. They might lose 4 to 8 kilograms and then nothing really. And in the meantime, their blood pressure's going up, their inflammation's going up, their chronic pain is going up.
Is difficult, right?
Oh, it's hard. I'm biased. I've never grown up eating meat. I couldn't imagine eating the diets that they come to me. And the portions are so small. I feel like I would be so hungry. Like, again, coming from growing up plant-based, I've always eaten dramatically more than anyone seems to know where it goes in my body. And I agree. Sometimes I'm like, I really don't know how my stomach fits this much food. I see it's like, 2 eggs and a coffee with butter in it for breakfast. Like, how that even vaguely became an idea for health, I have zero idea. But yeah, like I was saying, not only is their medical health getting worse, the weight loss doesn't continue in most cases, or they start to feel awful, nauseated, low energy, just anemia, a million things, like vitamin D gets really low. Just a lot of markers just don't add up to any recognition of health. And like I said, in those that then do transition, weight loss starts again. They start to feel better. All their biochemical markers and laboratory results get better. They're just incomparable, and I'm yet to find any convincing evidence of why you would go for any other diet other than moving towards a plant predominant diet.